The decision by the U.S. Department of Health and Human Services to cancel hundreds of vaccine-related research grants is not just an administrative choice. It is a deliberate step toward eroding the very foundation of American public health. As experts have now made clear, lives are at stake, and not in a hypothetical, abstract sense, in a direct, immediate, and potentially deadly way. Roughly 300 grants focused on vaccine confidence, access, and communication strategies have been terminated since January. That's nearly a fifth of the over 1,600 grants cut by HHS. The scale alone is staggering. But it's the target of these cuts that should alarm everyone. We are talking about research designed to prevent outbreaks of deadly, preventable diseases. Research meant to improve vaccine uptake in vulnerable communities, understand hesitancy, and protect children, and now it's all being tossed aside. At a time when measles, whooping cough, and even polio are creeping back into the national conversation, this move isn't just tone-deaf, it's reckless. It's dangerous. Dr. Douglas Opel, whose work focused on vaccine hesitancy in Native American and Alaska Native populations, described the cancellation letters as an abrupt and demoralizing end to meaningful work that communities depended on. These weren't redundant studies. These were critical investigations into why people are skeptical of vaccines and how to address that, issues that public health leaders admitted they mishandled during the COVID-19 pandemic. Now, instead of learning from past mistakes, NIH has done a complete about-face, essentially choosing willful ignorance over proactive problem-solving. One of the letters researchers received chillingly stated that NIH will not prioritize studies exploring why people are hesitant about vaccines or how to improve public trust. It's a statement so devoid of logic and scientific responsibility that it almost defies belief. As if avoiding the topic will somehow make the problem disappear. But it won't. And if we pretend it has, we do so at our own peril. Vaccine hesitancy isn't a fringe concern anymore. It's a mainstream threat. 1 in 5 parents in the U.S. now express skepticism toward childhood vaccines. And diseases that were once virtually eliminated in the U.S. are now re-emerging. Measles outbreaks are flaring up, and as Dr. Sean O'Leary warned, measles is the canary in the coal mine. If it's back, other infections aren't far behind. The context is even more dire when we look at the recent flu season. Over 500,000 hospitalizations, more than 23,000 deaths. Vaccination rates are dropping across the board. These cuts are happening in the middle of that decline. We're literally defunding the solution during a worsening crisis. HHS Secretary Robert F. Kennedy Jr. recently said parents should consult with their providers about the MMR vaccine, but stopped short of recommending it outright. This lukewarm, sidestepping approach isn't leadership. It's appeasement, and it sends a dangerous message at a time when public health needs clarity, not ambiguity. And while the administration insists this is about fiscal responsibility, the math doesn't check out. Cutting vaccine research is the definition of short-term savings, long-term cost. For every dollar spent on childhood vaccines, we save 10 in direct and indirect healthcare expenses. It's one of the most cost-effective health strategies known to man. And yet here we are, pulling funding from projects that are already midstream, leaving researchers stranded, data incomplete, and communities uninformed. Dr. Melissa Stockwell, another pediatrician whose work was cut, described it as devastating. Her research had already consumed over $1 million to study how text message reminders could increase flu and COVID vaccine rates in kids. It was showing promise. But now, not only will that study go unfinished, but its insights may be lost forever. It wasn't just her grant. It was a coordinated, nationwide sweep, a calculated shutdown of science. These researchers aren't speculating about harm. They're warning of it. And they're doing it loudly because the threat is real. This isn't just about laboratory studies or theoretical frameworks. This is about how we reach parents, how we build trust in communities, how we avoid watching hospitals overflow again. When public health funding becomes subject to political whims or ideology, when science itself is treated as expendable, we all suffer. We create an environment where misinformation thrives, preventable illnesses spread, and lives are lost not because of some natural disaster or unforeseen event, but because we chose not to act. Let's be absolutely clear. This is not a neutral policy decision. This is a step backward into darkness. This is the government turning its back on science, on children, on vulnerable communities, and on common sense. These cancellations are not just a blow to researchers. They are a warning to the rest of us. If this continues unchecked, we are not simply risking more outbreaks. We are inviting them. And in the months and years to come, when preventable illnesses claim lives that could have been saved, we will know exactly where to point the blame.